Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Main Hospital, Chennai. I specialize in hip and knee surgery, and in this video I will talk to you about infection after a knee replacement surgery. Knee replacement is an excellent option for many people and has extremely good success rates. Short-term success rates are over 98 to 99%, and most of them do really well. The one problem that still continues to sort of keep us very cautionary is an infection after a knee replacement. It is quite rare. It is about 0.4 to 1% chance after a knee replacement to get an infection. 0.4% means 1 in 250 patients can get an infection after a knee replacement. Although this is rare and very infrequent, still we are quite worried about it. We take a lot of preventive measures to control this problem. So how does this infection occur? Many of the times it is bacteria that are residing on the skin of the patient that goes in after a surgery, or it can be going from another organ of the patient like urinary infection. If the patient has some urinary infection after a knee replacement surgery, the bacteria can go and settle from the urine through the bloodstream to the knee joint. Or it can be a lung infection or a tooth infection. All these can go and settle in the knee joint and cause an infection. The other sources, of course, is the hospital environment, the instruments used, the surgeon, technical staff. All these are potential sources of infection. So in a place where knee replacements are performed in a regular manner, a lot of precautions are put in place to avoid these kind of contamination. Like we commonly use laminar flow air theatre to reduce the risk of infection, where there is an air filtration system. And then there are many protocols that are established in the theatre, like knee replacement cases are generally not performed in the same theatre or not in the same day before a knee replacement surgery. Instruments are sterilized in a very careful manner and handled in a very sterile manner. So these are all precautions that are well established in hospitals that routinely do knee replacement surgeries. It may not be possible or very established in places that do knee replacement on an occasional or a rare basis. So that is one advantage, you could say, of having knee replacement at a center that does it very routinely. The other thing is patient source. As I said, a lot of them have bacteria on their skin or in their organs. So we make sure that a lot of precautions are taken for this also. So generally in our place, what we do is we give a solution called Lysowash, which is an antiseptic to cleanse the skin 2 or 3 times before the surgery. This is used like a soap. The patient is asked to wash his entire body with the soap so that it clears the bacteria before surgery. And of course, some people have something called a nasal carrier, meaning they carry some bacteria in their nose. We apply ointments to get rid of these bacteria as well. In addition to these, we give injection antibiotics starting within half an hour of the surgery and then continue it for 1 or 2 days based on the patient's profile and the infection risk. So all these measures put together keep the infection rate very low, meaning 0.4% in good centers. Good hospitals throughout the world report an infection rate of about 0.4%, which is quite manageable, but still it is not zero. So we do end up seeing when we do volumes of knee replacement, when several hundreds are done, we do end up seeing 1 or 2 infections a year. So when these are detected early, meaning if the infection is very superficial in the post-operative period, just the skin and the upper tissues are involved, we can treat them with antibiotics and clear the infection. However, if the infection is slightly deep, meaning it is causing infection within the knee joint and not just in the skin layers, and if it is detected early, then what we do is something called a cleaning or a debridement procedure, where we open the knee joint, clear the infection within, irrigate the knee joint very thoroughly, and then put the patient on antibiotics. So this is called a debridement procedure, and this takes care of early infections that are detected within a few days to a few weeks. If you are able to detect the infection, then it can be cleared. However, if the infection has been persisting for some time, then there are some signs that we look for. Like a patient who goes home after a knee replacement has been doing reasonably well, then develops sudden swelling or pain and stiffness, then we have to look for infection. The other sign of infection is if fluid starts coming from the wound, then that is also a sign for a possible infection. If these are there, then what we do is some blood tests, namely something called ESR and CRP. If these are elevated, then we have to think about infection and make sure there is no infection inside. For that, what we do is we insert a needle into the knee joint and take fluid from it for testing. We do certain tests on this fluid and see whether infection is there or not. So based on the blood tests and the fluid analysis from the knee joint, we can in most cases confirm whether infection is there or not. If infection is confirmed, then we also try to isolate the bacteria which is causing the infection. In good microbiological labs, they are able to find the bacteria in over 80 to 90% of the cases. We can find out which bacteria is causing the infection. So these long drawn infections, other thing what happens is some of the bacteria form a film. It is called a biofilm on the metal surface and they reside there. Unfortunately, the antibiotics that we give through the blood are not able to reach the biofilm well, and the bacteria remains there if we do not change the metal implant. So if the infection has been going there for a long period of time, like more than few weeks to few months, and the biofilm has formed, then we have to take out the metal and replace it with fresh or uninfected metal to clear the infection. So this we do in two different ways. So as I told you, based on the knee fluid, we are able to say whether the bacterial infection, which organism is causing the infection. The organism is sensitive to antibiotics and known to respond well to antibiotics. Then we take out the metal implants, replace it with another set of metal implants in the same surgery. We call this a one-stage revision or a single-stage revision surgery. Following this, we give antibiotics, and this takes care of the infection quite well in most cases. However, if the bacteria that has caused the infection is known to develop resistance to antibiotics, then we do this in two stages. Meaning, in the first stage, we take out the implant, clear the infection, and then give antibiotics. We also put an antibiotic cement spacer in the knee joint. This continues to give antibiotics. In addition, we will supplement with injection antibiotics given through a cannula. This is done for about 6 to 8 weeks. We monitor whether infection is going down. This is done by taking the blood test, mainly the C-reactive protein or the CRP, and if this is going down significantly with every 10 to 14 days, then we can be assured that the infection has reduced and gone off. So once the CRP value is, blood test value is normal, then we plan for the second stage surgery, where we go in and put the new implant now in the second stage. So we call it a two-stage revision surgery. When we do revision surgery for infection, the success rate is about 90%, meaning in 90% of patients with this revision surgery, we are able to clear the infection on a permanent basis. So in summary, infection after knee replacement is a rare problem, but it can be quite bothersome. So we make sure that we employ multiple measures to avoid these infections. A good hospital with clean theatres, good instruments is one thing. Then decolonizing or disinfecting the patient prior to surgery with antiseptic washes, and then antibiotics during and after surgery is important. But if infection has happened, then we have to treat it. Superficial infections can be treated with antibiotics alone, but if it's a deep infection and detected within the early period, it can be treated with a cleaning operation called debridement followed by antibiotics. However, if the infection has been persistent for some time, then it will require a revision surgery where we have to take out the infected implant and replace it with a new implant. This can be done in one stage if the bacteria is sensitive to antibiotics. However, if it is known to develop some resistance, then we do it in two stages, or two surgeries might be required to eradicate the infection. Thank you.